Senator Peter Welch today says he's concerned about a, quote, crisis in primary care. He said he's introducing new legislation he hopes will keep more doctors fairly compensated. ABC 22's Jordan Barber in the studio with me tonight after catching up with the senator earlier today. Jordan?
Thanks, Lauren. At the conference this morning, Senator Welch introduced a bill called the Physician Fee Stabilization Act to address primary care provider pay in the state. The bill, which has bipartisan support, hopes to achieve the goal of fair pay for medical professionals who are experiencing cuts due to decreasing Medicare reimbursements.
We've got a crisis in healthcare, as we all know. It's too expensive in all kinds of ways. But one of the effects of that is there's enormous pressure on what I think are the most important people in our healthcare system.
This is how Senator Peter Welch described the financial strain on primary care professionals Monday morning. He said one of the reasons, underpaid physicians and a decrease in reimbursement for Medicare payments.
The crisis that primary care is facing is that in our upside down, extraordinarily expensive healthcare system, we're putting a squeeze on primary care, paying them less than it costs oftentimes to provide the care that they need.
To address the issue, Senator Welch and Republican Senator John Boozman of Arkansas introduced the Physician Fee Stabilization Act. The legislation would ensure more flexibility in determining pricing adjustments for medical services without causing pay cuts to Medicare-serving physicians. Jessa Barnard, the executive director for the Vermont Medical Society, expressed support for the bill, echoing Senator Welch's prior statement.
If services are not paid for, medical practices in Vermont won't be able to keep their doors open to serve the needs of Vermonters. Some may be forced to close altogether, while others may have to make the heartbreaking decision to limit how many Medicare patients they can see.
Dr. Toby Sadkin, a family doctor in St. Albans and the chair of Primary Care Health Partners, says the PCHP network provides care to over 30,000 Vermonters. But payment for the primary care has not kept up with the cost of services, putting them at risk.
Costs for almost everything have been increasing, yet Medicare payment for primary care has decreased yearly for the past 4 years and is scheduled to decrease further with a CMS proposal for a 2.8% cut to primary care payments in 2025.
The Vermont Medical Society says more cuts across primary care are to be expected in 2025 unless changes are made. Welsh hopes that by the end of the year, he and his colleagues can get the Physician Fee Stabilization Act included in a must-pass bill. Reporting from the studio, Jordan Barber, ABC 22 News.